I'm Dr. Jeremy London. I am an actively practicing board-certified cardiovascular surgeon, and I've been at the bedside for over 25 years. And today's episode is going to be vaping. And this is a topic that I am very passionate about. And primarily because, like the majority of my practice, when I see patients as a result of vaping, it's at the end game, at the worst case scenarios, typically severe lung injury as a result of utilizing vape or e-cigarettes. And these are very sick individuals, so sick many times that they actually require something called ECMO, which is an external lung, where we put a large tube in the neck and one in the groin, remove the blood from the body and place oxygen into the blood and return it to their bloodstream, because their lungs are so severely damaged simply from vaping that their own lung capacity is not adequate to support life. And I've done this innumerable times over the years, and unfortunately, these are typically really young individuals, and sadly, several have not survived. And I have 3 kids, and it's very difficult for me to watch this go on without sharing this information with you so that you understand the potential risk associated with vaping and e-cigarettes. The Centers for Disease Control also think it's very important. They have developed a registry called EVALI, E-Cigarette and Vaping Associated Lung Injury, to document the number of cases across the country. Right now, that registry has about 3,000 patients in it. 68 of those patients died, and 1 actually went on to require heart transplantation. So the gravity of this problem is significant. And if you know somebody that vapes or that would benefit from this video, please share it. This is truly a public health epidemic. Think about the number of young people or people in general that you know that vape. In 2019, there was a study that showed that almost 30% of high schoolers are currently vaping on a daily basis. Now, I'm not going to tell you what to do or what not to do, but give me this, a little bit of your time to understand my perspective on vaping and where the current data stands, so that you're educated and understand the significant risks of vaping. Through the course of researching this topic and my personal experience, I felt that one of the most instructive ways to give you a foundational understanding would actually be to take the 5 most commonly listed support or value for vaping that you commonly see in media and from friends or family that are actively vaping, and address each of those issues individually and give you my opinion and the literature that actually refutes each of these, so you understand why these arguments may not be as convincing as they seem on the surface. The first is that harm reduction with comparison to cigarettes. In other words, vaping is safer than cigarette smoking. The second is utilizing vaping to get off of cigarettes, smoking cessation, utilizing it as a tool for smoking cessation. The third is a decreased risk of exposure to toxic materials. The fourth is potential immediate health benefits, again, moving from smoking to vaping. And the final one is the fact that the FDA has oversight over nicotine and tobacco products in this country. But before we dive into these particular areas, I want to talk briefly about some very basic functions of the lungs. And it's really 2: air in and air out. When you inhale, you're breathing oxygen into the body, which brings oxygen and nutrients to all your tissues. When you exhale, you are removing carbon dioxide as waste products. Anything else, utilizing your lungs for anything else, essentially is toxic. Those are the two major functions of our lungs. We'll get back to the podcast in a minute. We'd like to thank our sponsor, Function Health. Taking control of your health starts with understanding your biometrics. I use Function Health to tailor my nutrition and wellness plan. Function offers over 100 plus biomarkers to give you a comprehensive picture of your health at an affordable price. Their advanced testing includes 5 times the standard primary care panel. Testing for biomarkers ranging from heart health, hormone status, kidney function, nutrients, and more. Not only will you see which biomarkers are in and out of range, but Function will also analyze each biomarker and offer insights from top doctors in their specialties. Clinicians will contact you promptly if any urgent results arise. Knowing your data is powerful. Function helps you navigate the information and allows you to design a biomarker-driven plan to maximize your health span and lifespan. If you are interested in getting your 100 plus biomarkers, visit www.functionhealth.com/London and you'll receive a $100 credit on your membership. That's www.functionhealth.com/London. Check it out. Now let's get back to the podcast. So let's jump into it. The first and the most popular argument for vaping, and that is that vaping is safer than cigarette smoking. The short answer is they're absolutely right. And the reason for this is that, at least in the short term, the number of toxic metabolites that you are inhaling into your lungs with cigarettes versus vaping is dramatically less. And the reason for that is because you're burning the paper from the cigarettes as well as burning the tobacco themselves. That doesn't happen with vaping. But what you have to realize on the front end is that we're really not comparing apples to apples here. We have 200 years worth of data related to cigarette smoking. 70 years ago, the Surgeon General actually put out the statement that cigarettes were directly causative of lung cancer. Prior to the 1930s, we didn't have much lung cancer in this country. And after 1930 is when we started to see the rise. For many years, smoking was not only the sexy and cool thing to do, there was actually advertisements that said it was good for your health. Clearly, that is not the case. And the other thing that you have to realize, because we have such a wide breadth of data associated with cigarette smoking, we have long-term outcomes with the use of cigarettes. Vaping was invented in 2006, became popularized in 2010, and got really popular in about 2016. So we really only have about 10 years worth of data. So we don't truly know the long-term implications of vaping. So at first glance, it may appear that yes, there are less toxic chemicals and metabolites in the vaping smoke with compared to cigarette smoking. But the reality is we don't know the implications. And remember that it's not cigarettes are toxic and vaping isn't. There are still significant toxic metabolites associated with vaping. That can be from the preservatives in the smoke plume that you see. Those are usually glycerol or potentially even vitamin E based, as well as heavy metals that typically come from the heating element in the vape itself. So realize that it's not toxic metabolites versus none. It's just less and also different, and we just don't know the long-term effects of the continued inhalation of these chemicals long-term. So remember, thinking back to the simple functions of the lung, air in and air out, anything that you're inhaling has toxic potential. And whether it's cigarettes or whether it's vaping, you need to be cognizant of this fact. And even if you have never been or never considered being a cigarette smoker, vaping still has implications. Think about it like this. Cigarette smoking may be a 3-pound rock held over your head at 6 feet, and vaping may be the same 3-pound rock held over your head at 3 feet. One is dropped from 6 feet on your head and may cause some long-term implications or potentially death. But the 3-pound rock is also dangerous, and if it hits you just right in the head, like some of the patients that have severe acute lung injury that I've had to put on ECMO, and a few of which who unfortunately didn't survive, it can do significant damage. The next argument is one that I hear frequently in my office, just because a lot of my patients are active smokers or potentially former smokers. And I realize this doesn't necessarily apply to everyone that just vapes, particularly the young population, but it is positive media coverage and patient perspective that I think is important to cover. And that is, I used vaping to get off cigarettes. If I hadn't used my vape, I would still be smoking. Well, think about that. Of course that was successful. You're just trading one nicotine product for another. It's just a different vehicle on how you can inhale that into your lungs. Again, something you're inhaling into your lungs that's not air. So it's not a huge surprise that that's an easy transition, but it's really an out of the frying pan into the fire situation. You're really not gaining very much by, or anything at all as the case may be, by shifting from cigarettes to vaping, with the exception of those immediate toxic metabolites that have been in the forefront of media coverage over the last few years in support of vaping. The next category is one that we've already touched on, but again, one that gets a lot of focus, and that is this reduction on toxic metabolites. So let's assume for a minute that that is the case, and that has been proven with benchtop research that there are less toxic metabolites in vaping. But vaping has become a social norm. What do I mean by that? Well, you don't have to go outside to smoke because it's essentially odorless inside. You don't have to go into the room of shame at the airport to vape. And so the amount of exposure that you get through the course of the day is exponential when compared to cigarette smoking. So although the volume of toxic metabolites may be lower in vape materials, the amount that people are vaping is significantly more than smoking cigarettes for the most part. In addition, think about the plume of smoke that is put off with vaping. You can see it when you're driving down the road, coming out of the cars, or behind someone in a restaurant, whatever the case may be. But because you can get these really full inhales, because it's very easy to take very, very large quantities of this smoke, if you will, into your lungs without coughing or having it be an immediate irritant like cigarettes, the amount of toxic exposure that you're getting, again, is exponentially higher than it is with daily cigarette use from a volume standpoint. An additional argument or comments that I hear from patients and their families when I see them before surgery regarding smoking is that they've transitioned to vaping because they understand that there are supposed to be immediate health benefits by shifting from one to the other. This actually is frankly just not true. But what health benefits are they talking about? They're talking about lung function. In other words, shifting from cigarettes to vaping actually improves your overall lung function. And in a very small population of patients where they have severe lung disease as a result of smoking, there may be a slight improvement. But when lung function tests are measured with patients and individuals that only vape, typically speaking, they're just as bad as they are with active cigarette smokers as far as the restriction of lung capacity, as well as chronic cough, shortness of breath, and chronic bronchial irritation. Those patients still have immediate effects from active vaping, very similar to patients and individuals that continue to smoke. We'll get back to the podcast in a minute. I'd like to thank our sponsor, IM8. Now, we as a family like to get 80 to 90% of our macro and micronutrients from a whole foods diet, but I use IM8 to cover the rest. Remember, this is a supplement, not a substitution for a solid whole foods diet. I drink it every day, 1 scoop in cold water, and it tastes great. IM8's got 92 essential vitamins. It's got prebiotics, probiotics, and postbiotics for gut health, MSM for joint health, and CoQ10 for heart health. They've also got these super convenient travel sachets when you're on the go. If you're interested in trying IM8, visit their website, www.im8health.com/London. They're offering a free welcome kit and 5 of these travel sachets with every subscription. Check it out. Let me know what you think. Let's get back to the podcast. And the final argument in favor of vaping is this has to be okay. The FDA has oversight of these products. There can't be anything harmful in here like diacetyl for flavorings and formaldehydes and heavy metals and all these things that have actually been isolated from many vape solutions. The short story is, yes, the FDA does have oversight, but it is very limited oversight, and it falls under the purview of the tobacco industry. So in other words, what they can ensure is that the packaging is correct, that warning labels are appropriate, and that there is some limitation on the amount of advertising that can be done focused on the younger population. But it doesn't truly regulate what's in vaping solutions. It's not like medications. It doesn't require a prescription. And so although the FDA has oversight, the amount of control that the FDA actually has is fairly limited. So don't be lulled just because there is technically government oversight that what you're putting in your body in this case is safe. Now, that being said, the FDA is working very hard to combat the vaping industry, but it is a moving target because, again, a lot of it has to do with the packaging and the delivery systems, whether it's contained in a liquid form or if it's in a cartridge or not in a cartridge, or whether it's disposable or not disposable. And so the industry just shifts according to whatever the new policies are. Most of their efforts now are again focused at this epidemic across the country, which is young individuals being targeted for these very tasty flavors in colorful packages with this really cool activity of vaping, and trying to protect the youth of this country. Case in point, in spite of all of these efforts, vaping continues to grow in popularity. In 2019, there were 30% of high schoolers. I don't have the actual current data. My suspicion is it's at least that, if not more. And my impression is that there are actually more adults shifting to vaping for many of the reasons that we've already gone over. So it continues to be a growing problem, even with government oversight. In 2023, there was a scientific statement paper from the American Heart Association that was published in Circulation, which is a peer-reviewed journal. In other words, one of the high-quality medical journals that is validated and utilized. There's a lot of journals out there. Not all of them have the same credibility. Circulation is one of the most credible journals in the space. And this article, and we'll drop the link below so that you can look at it yourself, But let me give you a brief synopsis. It reiterated some of the things we've already gone over. The fact that cigarette smoking from a metabolite standpoint is clearly more dangerous than vaping. They recognize that. But they also recognize, as we have already discussed, that in essentially any other category except for one, which we will touch on, we just don't have adequate data to make a statement about the safety of vaping because we have no long-term outcome data to base that type of decision on. Where they say we really have strong data is in acute lung injury. Again, the basis for this EVALI, e-cigarette and vaping associated lung injury category, to say that there are patients, and in my case, my experience, otherwise healthy young patients that I've had to place on the external lung machine. Again, remember, a large tube in the neck and one in the groin, removing the blood from their body, oxygenating it, and putting it back in their body because their lungs are not capable of bringing enough oxygen in the body and removing the waste products to stay alive. And unfortunately, in spite of even something this dramatic, putting it into sixth gear, if you will, to try and save these young patients' lives, they still don't survive. And I've never had to do that for a patient that was smoking cigarettes. And I think that's a really important point. And if this video keeps one person from vaping that may have been a victim of acute lung injury, it's worth it. Now, look, I understand it is really hard to quit. Nicotine is incredibly addictive. And I'm not going to soapbox you. I'm not going to judge you. I really just want to help you understand where we are currently with the information and the importance of educating yourself. Let me give you a brief overview of how I counsel patients in my office about smoking with regards to cardiovascular disease and the operations that I do, again, in the game operations as a result of chronic cigarette use. And it typically goes something like this. Remember that whether we do bypass surgery or stenting, it doesn't treat the underlying problem of the hardening of the arteries. And we all have to take responsibility for making lifestyle changes that then can modulate that process. We're willing to take the upfront risk with you to go to the operating room and get you out of trouble by getting blood flow to an area of the heart muscle that's blood-starved. But if you continue to smoke, all bets are off. Bypass grafts usually last 12 to 15 years if all the things are in place. If you're smoking, that could be 6 months. It could be a year. Very, very unpredictable, but it's very important that you take responsibility for your own health care. I don't soapbox patients. I tell them I want you to understand the implications. If you continue to smoke, that ultimately is your decision. But these bypass grafts are likely to fail if you do so. And those are the facts. And I think that the education piece here is really important. So what are the things that work when it comes to vaping cessation or smoking cessation? Well, the first, nicotine replacement therapy. And by the way, vaping is not an FDA-approved nicotine replacement therapy. What is? The nicotine gum, the lozenges, the patches, and those things tend to work fairly well, as does individual therapy, group therapy, some sort of economic reward, either that you're going to save a lot of money as a result of not buying cigarettes or not buying vapes, or that you save that money and then purchase something as a reward every couple of months for not smoking. Those are the things that have actually been proven to work. But ultimately, none of those things are effective until you decide between the years that you're ready to quit. These things will help, but you have to make the decision that you want to quit. You have to take responsibility for your own health care. You know, it's interesting when I'm having these conversations with patients that vape and smoke, they all know it's bad for them. In fact, many of them start the conversation by, I know I'm a smoker. I know it's bad for me. I just really struggle. And there's so many instances in our lives that we know better, but we just don't do better. It's a theory called cognitive dissonance. And you can convince yourself in situations in many different ways. Sometimes I have kind of angry patients that come in and say, you know, I've got an aunt that smoked for 75 years and she didn't have heart disease and never got lung cancer. And yeah, it's one individual. There is strong data, as we are all aware, that smoking causes lung cancer. And there's many situations in our lives where we know better, but we just don't do better. So how do we bridge that gap? How do we bridge the gap to get to the place that we're ready to quit smoking between the ears? Since that is the foundational piece. And it's through education and through understanding what you're doing to your body when you make a choice to vape and smoke. And quitting vaping and smoking is probably going to move the needle more than any other decision, whether it's your diet or a regular exercise program or a solid sleep hygiene program or your social circles or whatever the levers may be that you're working towards with your own health span and lifespan. Quitting vaping or smoking will be the single most important thing you do. My hope is that I can pass on the information and my experience with vaping, because it has had a huge impact on me given the gravity of how sick these young patients are and what we have to do to try to keep them alive. And I want you to understand that this is a real danger. And if someone you know vapes, someone you care about is thinking about vaping, please share this video. It could save a life. If you have found this podcast helpful and you've enjoyed it and you're watching on YouTube, please like and subscribe. If you're listening on Spotify or Apple Podcasts, you can leave up to a 5-star rating. I hope you guys have a great day.